Hi all. So today we're going to be talking about chronic obstructive pulmonary diseases, or COPD. COPD is a trifecta that includes asthma, emphysema, and chronic bronchitis. So COPD are any recurring lung disease that cause difficulty breathing, wheezing, shortness of breath, and any related symptoms. The very important thing to understand about COPD is that they cannot be cured and they cannot be undone. Once damage has been done to the lungs, there's nothing to be done to go back. So people with these conditions must take action to prevent any further damage. The first of the COPD that we're going to talk about today is asthma. Asthma is a chronic inflammatory disease of the lungs and airways. So there are different symptoms that affect people with asthma, including shortness of breath, wheezing, coughing, a tight chest, coughing, sleep problems, a high risk of respiratory infections. There are three different specific kinds of asthma. So there's exercise-induced. So that means anytime they're doing exercise, they're going to have increased symptoms. There's occupational asthma, which can come on in adulthood or any time that you're exposed to dangerous pathogens or pollutants in the air. For example, maybe asbestos, using that at your job can increase chances of getting asthma. And then there's allergy-induced asthma, which is seasonal allergies, pollen, grass, anything outside can increase asthma symptoms. There are two different kinds of causes of asthma. So asthma can be caused by genetic factors. So if it runs in your family, you're much more likely to experience asthma symptoms. And then there's also another trifecta. So eczema, allergies, and asthma all go together. And if a child or a person has any one of those, they're more likely to present the others as well. It's also been found that women are twice as likely as men to have asthma. One study found that maybe the testosterone in men actually helps act as a first line of defense against excessive immune reactions to triggers. So when you're around a trigger, your immune system is overreactive, and that's what causes the constriction of the airways. But with testosterone in men, it actually reduces that constriction of airways. The other kind of factors that cause asthma are environmental factors. So again, this is air pollution, including secondhand smoke, as well as anything going on in the atmosphere if we have poor air quality. There are certain triggers. So as we talked about, exercise or allergy-induced. Higher altitude can increase asthma. And then another study found that low levels of key gut bacteria in babies under 3 months of age actually were much more likely to develop asthma later. So scientists believe this may be somehow a cause of asthma, and that would be another environmental factor. How is asthma diagnosed? So there's spirometry, which it's a test, as you can see in the picture, that measures lung content. It assesses the severity of the illness, and it can tell if that person is on a treatment for their asthma, whether or not it's working. However, there has been a study in 2015 that found that spirometry tests overdiagnosed 36% of children with asthma with a higher level of severity than their symptoms actually indicated. However, regardless of the overdiagnosis, the author still recognizes that spirometry testing is a valuable tool. Other tests include the FeNO, or the nitric oxide test, which measures the amount of nitric oxide exhaled and measures lung inflammation. And then you can also, if it's allergy-induced asthma, then an allergy test can be conducted, like a scratch test, to determine what those allergens are. We're going to talk about asthma treatment. So as I mentioned, COPD is incurable. However, one 2007 study does argue that asthma is not in fact incurable, and that treatment via rigid bronchoscopy allowed 70% of hormone-dependent participants studied to recover completely from their condition. The reason bronchoscopy is not widely used is that it's invasive and can cause life-threatening complications if performed incorrectly. However, it would still be an interesting venue to examine further. So there's two kinds of medication. There's quick relief medication, so that's taken when symptoms have already begun, have onset. These are short-acting beta agonists. So these are inhalers. The most common one is albuterol sulfate. Then there's controller medication. These are taken every day and reduce the flare-ups from asthma over time. So there's corticosteroids, which are usually inhaled but can be given orally or through IV. There's long-acting beta agonists, which help open airways, and there's something called leukotriene modifiers, which are taken orally. Next, we're going to talk about bronchitis. Bronchitis can be chronic or acute inflammation of the bronchi in the lungs. Symptoms of bronchitis are wheezing, coughing, mucus, shortness of breath, chest discomfort or tightness, and fatigue. Viruses usually cause acute bronchitis, although there is also bacterial bronchitis, which may be treated by antibiotics. The other kind of bronchitis, chronic bronchitis, can be caused by air pollution or exacerbated by air pollution, but the primary cause of chronic bronchitis is cigarette smoke. Bronchitis can be diagnosed, again, by spirometry and also by a sputum culture, which measures the concentration of mucins in mucus. So a 2017 study has determined a way to quantify the severity of chronic bronchitis for the first time. By measuring the mucins, this helps them determine the severity of the bronchitis, which has never been able to be quantified in the past. Mucus normally allows our lungs to function properly by catching dirt and bacteria, but an excess of mucus negatively impacts the affected individual's lungs. With chronic bronchitis, mucus concentrations can increase from 2% to 4%. Finally, a chest x-ray can be done, especially this can be used to tell whether the individual may have other illnesses such as pneumonia. How do you prevent and treat bronchitis? So acute bronchitis can be treated by good hygiene. It goes away by itself. Obviously, you can treat it with cough medication, but really it just needs time. But for chronic bronchitis, the best thing to do is to stop smoking cigarettes. Stopping smoking, again, will not repair the damage, but it can help prevent future damage. Other treatments are humidifiers, bronchodilators, and mucolytics. So bronchodilators, actually, in a 2017 study, did not show significant improvement when compared to a placebo for patients with chronic bronchitis. So the effectiveness of those treatments is questionable. There's anti-inflammatory medication, and if bronchitis progresses too far, oxygen might be needed as well. Finally, we're going to talk about emphysema. So emphysema is an illness that affects the air sacs in the lungs, which causes them to decay. They stretch out, they lose elasticity, and so they don't pump air as effectively as healthy lungs do. The symptoms of emphysema include shortness of breath, mental fog, blue lips and fingernails after prolonged physical effort, and can later lead to collapsed lungs and heart problems. There are kind of two major causes of emphysema. The primary one is smoking or secondhand smoke, and then air pollution obviously is a kind of exacerbating factor with that. The other one is AAT, or alpha-1 antitrypsin deficiency. So this causes normal white blood cells to actually damage your lungs without anything to do with smoking. It's pretty rare. It only affects 1 in 100,000 Americans, and it's most common in Caucasian populations, usually from Europe or North America. One study showed that in 2010 that treating AAT deficient patients with alpha-1 proteinase inhibitor actually slowed lung damage compared to placebo. So hopefully we can go ahead and find a solution for that. And checking for emphysema could be measured, or the progression can be measured by lung density tests. So I hope you've learned something about COPD and about these illnesses, and thank you for watching.